Welcome to Youth Diary. Urinary problems of any sort can cause a great deal of discomfort and embarrassment. Today we have Dr. Mohammed Saheed with us. He is an eminent urologist and andrologist. He is working at Sunrise Hospital, Cochin. Doctor, welcome to our show.
Thank you.
In your common practice, what are the commonest problems among youth that you come across?
See, when you ask such a specific question, if it is an adolescent, maybe from 15 years to 20 years, we get urinary tract infections, we can get stones, and we can get genitalia related problems like phimosis, where the foreskin does not come back. Those are the common problems you find. And then congenital anomalies, that is, children are born with these problems of kidneys and ureters. All those problems also present at later ages also.
So doctor, we have some video clippings. Let's have a watch on that.
Hello ma'am, I am Vishnu. I am doing MCA at Ascengist. Ma'am, my doubt is that in last 6 months I have noticed red colored urine twice. Should I see a doctor, or what could be wrong with me?
See, red colored urine does not necessarily mean that it is blood in urine, but then it is very essential that he gets checked this urine for blood cells. So the commonest cause for blood in urine in this age group can be stones, can be urinary infections, or it can be stress related, or when he strains a lot, his bladder may have some contusions or inflammations, and then he may pass red colored urine. Or it may be a totally unrelated condition like kidney disease, medical diseases of kidney like glomerulonephritis.
Some serious illness.
So it is essential that he gets his urine checked first to confirm that it is red blood cells, or that is blood seen in urine. And the second thing is that where is the problem, whether it is the kidneys or the bladder or so. So he should have at least a scan or an X-ray done. So it should not be left alone, and he should go and investigate with a doctor.
That means he don't have to wait
No, he doesn't have to, because it's already 2 episodes in the last 6 months. So it's better he gets it checked.
As early as possible.
As early as possible, right.
So we'll go on to the next question.
Hi ma'am, I am Anwar, I am doing MCA. I have doubt, I am getting recurrent urinary tract infection. What should I do?
Actually, he's an engineering student.
From the clipping it appears that he's around 20 years old. So urinary tract infection in a 20-year-old. Again, it may be totally as one episode of urinary tract infection, but in a male child, it requires investigation, because usually it is the female child who gets a recurrent urinary tract infection at this age. So when a male gets an infection at this age, he should get investigated. It may be again urinary tract infection may be because of congenital problems, or it may be due to stones, or it may be due to any other illnesses which may be bacterial colonization of the urinary tract. It may be secondary to some primary condition. So we have to rule out all these conditions either with a urine culture and an ultrasound of the kidneys and the urinary tract.
And doctor, I have a doubt here. Will an improper cleaning of the genital area can it cause urinary tract
Because urinary tract infections are reported to be more common in uncircumcised male child. But that does not necessarily mean that they will get more infections. But it is noted to be less in circumcised children. So it is always necessary that he cleans his genitalia and he cleans his foreskin, and so that unwanted secretions does not collect under his skin. So that's a must in any age group.
And what about dehydration, doctor? Not taking enough water nowadays, at least in this climate.
Because ours is one climate where there is a lot of humidity, so we tend to sweat a lot. And these children may be playing in the sun, and or maybe driving or riding on a bike or walking. So they are bound to have dehydration. So at least 2.5 to 3 liters of fluids every day in summer is necessary.
Okay.
And they should drink according to the color of urine. If the color is deep yellow, he should find that next day he should drink as much water so that his urine is white,
Okay.
like the color of the water he drinks.
Okay.
And whenever he is thirsty, he should have water.
Okay.
Not that he should not have water. So.
And one more doubt here is, what about holding the urine for a long time? I mean, without passing.
Yeah, that
holding
is
it for
also one trend that is more common in female children.
because nowadays it's so common that
Yeah.
in schools and colleges
Yeah,
they
the toilets are not clean.
Okay.
That's one reason why children tend to
They
use
hesitate to
less,
go, yeah, I know.
utilize the toilet facilities at schools or colleges.
Okay.
So it is better during the interval they go and pass urine for two reasons. One, urine does not collect inside and lead to unwanted complications like stone formation or infections. So that's and then he or she should have enough water so as to have a good cycling of the urinary tract.
Okay. Okay, doctor. Let's see what our next friend has to say.
I'm Mohammed, 23 years old. I have lower back pain and abdominal pain, and my urine has got a bad odor. Could this be a problem?
No, from his question, all this is pointing to a kidney problem. He has a back pain because the kidneys are usually located in the flanks, that's behind. So the pain can come from here till lower abdomen. So radiating pain. That's one reason for the pain. And then he's having bad odor in urine. It may or may not be a urinary tract infection, but unless he gets it checked, so it's better that he sees a urologist and gets at least 2 investigations. One is to check his urine and find out whether he is getting an infection. And the second thing is why is he getting that pain. So you should have an ultrasound of his abdomen.
I think if my memory is not poor, I remember this guy is suffering from I think for the past 3 or 4 months.
Yeah.
He's been suffering from this problem.
So it's at the earliest he should meet a urologist and solve his problem.
He was telling that he was not getting enough time to go and meet. So we'll move on to the next problem.
Hi ma'am, my name is Anis VM. I am a final year BTech student of KME Engineering College. I have a doubt. My friend, 15 years old, he always urinate in the bed at night time. What's the remedial measurement against this?
To prevent this.
Yeah.
I think
that is from his from his question. What we call this is a medical condition called as nocturnal enuresis, that is passing urine in the bed at night time.
Especially at this age.
At 15 years is quite a high age for not having control over his bladder. But then here again it is now understood that it is a behavioral disorder or a learning disorder of the bladder, where the bladder has forgotten that it shouldn't leak without the master's permission. So it has to be retrained. So he has to get it trained how to control his bladder. So this is more common in children of parents who had bedwetting when they were.
There is a family history of bedwetting.
Family history. Normally, this bedwetting gets controlled by around 15 years of age. But when we analyze this history, we find that at least once in one night, the concerned person wets his bed. So we have to go to a family history here first. Take whether the parents were bedwetting, number one. Number two is from what age did he have his normal urinary control, because normally boys will have urinary control by around 2.5 to 3 years of age. So if he is a primary enuresis person, that is, he has never had a nighttime bladder control till this age, 15 years.
That means he was always
wetting from childhood. And whether it was a secondary, that is, he had a normalcy in between and then he started it all over again.
That means he was dry at night for some time and then again started.
It's very difficult to treat the primary person, but it's easy to treat the secondary person. So secondary person, it may be related to some urinary infections. It may be related to some other things, so which we have to do. But the primary thing we have to do is we have to get the proper history. At what time of the night is he bedwetting? So ideally we tell them to have a bladder control. That's by keeping an alarm clock by his side so that he gets up just before he leaks. So if he leaks at around 12:30 or 1 o'clock at night, we ask the parent to set the alarm to around 12 o'clock.
Okay.
And by hearing this alarm, he has to get up.
Oh, okay.
Not somebody goes and wakes him up.
So
if
he
somebody
has to get
goes
up
and
of his own,
wakes him up, he may not control it that very
he may
well.
pass off.
Yeah.
Okay.
So one parent is advised.
Okay.
That's one thing. And the second thing is he should not take any diuretics, that is things that produce excessive urine at night.
Okay.
So after 6 o'clock we ask the parents not to feed them with fluids. Then we advise him not to have too much sweet dishes or sweet tasty food at bedtime.
Okay.
Chocolates are to be avoided, and make sure that he's not constipated, all those things.
Oh, will this constipation
Also can. So, and the last thing is to give prescribed drugs. Most of the drugs won't work, and I think behavioral therapy is the one that works better.
Okay.
And there are drugs which are given, and in non-responders we try drugs also. But even without drugs, some of them will have a self-limiting by around 18 years of age. Okay. So they don't carry it into their adulthood. That's what we have seen. Very rarely some persons are reported to us with adult enuresis.
That means most of them will be having some underlying problem.
Yeah, some underlying problems will have to be diagnosed in.
Doctor, till what age we can take it as normal, in the sense like bedwetting? Till what age? I mean,
there is nothing like
I mean, especially in kids and all, it's always.
Yeah, but if he continues it beyond a particular age, like around 4 to 5 years, we think that he should be investigated, or he should have some behavioral therapy. So normally male children they get control over their bladder even while they are sleeping around 3 to 4 years of age. And very few percentage, that is 15 to 20% of them may find it very delayed.
Okay. So you mean to say that doctor, the problems, the underlying problems has to be treated first, then only it can be cured.
Yeah, at least a basic urinary examination and evaluation by a pediatrician will be enough. If he finds that everything is normal, then you don't have to worry too much about it. And then never punish the child.
Okay.
See, punishments are not going to bring out good results. Always reward the child for not having bedwetted the last night.
Okay.
So that will positive conditioning. So that's what helps them better.
I think punishment will make them more stressed.
Yeah, stressed. They will be stressed and they will continue to do it.
So we'll see the next.
Hi ma'am, I'm Naufar. I'm doing my BTech in KM Engineering College, and I'm here for asking you some question.
Okay.
And it is actually, my friends have used to smoke like a lot of cigarettes, and I have heard that it will affect the future life. Okay. Is that it? True fact?
The commonest.
Smoking.
Yeah,
it's smoking is one habit you pick up when you are in with a group of people. So it usually happens when you are in the schools, when you have access to a smoke, and it starts off as a mob psychology thing, and then it gets addicted.
Okay.
So it is always better to avoid such friends who smoke and tell them that it is dangerous. So it is the years of smoking and the frequency of smoke that counts. So if we start smoking at a younger age, maybe by 15 or 16 years of age, he continues to smoke till maybe 30, 40, 50 years.
Okay.
So, and the number of cigarettes also will
be counted. Okay.
Yeah. Okay. So smoking is the single most risk factor for all the diseases. It can produce diabetes related complications may go up when you smoke. Then all the chronic diseases with smoking, if you combine, it is prone. He is prone for survival period will be shortened. So, and it can produce deleterious effects on the brain, lungs, urinary bladder, stomach, upper GI, upper gastrointestinal tract. So it can produce cancers also. And smoking with other chronic diseases are lifestyle risk also is there. So smoking is one thing which needs to be avoided so that you live longer and you don't shorten your lifespan, because you are bound to get other lifestyle diseases also. So when you combine smoking and other diseases, the risk factors always goes up.
Yeah, that means you're buying a disease. I mean,
yeah, you're bound to get diseases,
Okay,
and with an avoidable thing, it's better to avoid it so that you don't, increase the effects of other diseases, killer effects of other diseases.
Okay. I think it's the same with the alcohol also.
Yeah,
Yes,
alcohol also is something in which works, in moderation it is okay, but when it is excessive. But smoking is to be avoided completely.
Okay.
But alcohol, you can have limited amounts of alcohol, maybe once in a week, or not binge drinking, maybe 50 or 60 ml in a week, because social drinking is allowed by our society. But in our society, Kerala, we think that alcohol is something which we cannot get away with, and people start. I have seen students, 8th standard, 9th standard, smoking and drinking. So it's very difficult, to tell them that this is dangerous, because at that age they are very rebellious, and anybody who advises them,
they become their enemies, right?
Yeah.
Doctor, I have a doubt here. Will this alcoholism or smoking, will it affect our sexual function? I mean, will it cause
because at a young age, if you start alcohol and smoking, the pubertal growth spurt may be affected, and then the testicular functions will be affected, and the hormonal levels are going to be affected with alcohol, because of its deleterious effects on the liver. So there will be poor androgenization, that is male characteristics in the male will not happen. So he'll be having loss of facial hair, he'll have breasts like a female, gynecomastia it is called. So excessive dependence on alcohol and in huge quantities over a period of time, like 5 to 10 years, will produce all these effects. So the puberty and infertility, because the semen or the spermatozoa may be of poor quality and he will not be able to reproduce. So there are a lot of problems associated with this adolescent alcoholism and smoking.
Oh, that is really a new information, doctor.
Okay.
Doctor, we have a mail here. I am a 20-year-old MBA student. I always think about having sex. Why do I feel like that?
Yeah. Actually, there is nothing to be embarrassed about asking such a question, because at this age it's very common, because after puberty you have the male hormone levels going up, testosterone.
Okay.
So around 20 or 25 he's going to have a very high levels of testosterone level.
Okay.
So with that male hormone, he is supposed to get all this erotic sensations and all the stimulus related to identifying the opposite sex will be very, very high in this age group.
Okay.
So it's very common that every 20 minutes at age of 20 you think about sex.
Okay.
So that's very common. But it is how you curb those feelings and how good you come over such feelings. That is what makes a gentleman and a civilized man.
Okay.
So in animals this is not possible. So they go and attack all those opposite sex animals. So,
okay.
but as a civilized and society, it's always good that we understand such a feeling. But we have an inhibitory stimulus from our brain.
Okay.
That it is a
control over.
Yeah, you have to control yourself, and it is not good thing to express it publicly.
Okay.
So certain things have to be kept as a secret thing,
Okay.
and it's always good that you discuss this with your friends,
Okay.
over a cup of tea or when you are chatting.
Okay.
But it's very embarrassing for you to express it.
Okay, publicly.
Publicly.
Right.
So I would say that it's good that you have such a feeling. That means your hormone levels are okay,
Okay.
and you're growing normally.
As a doctor, you are
Yeah.
happy, right?
Yeah, and you're growing in a normal way, that
Okay,
you don't
right.
have any other problems, nor do you have any other inclinations.
Okay, right.
Right.
This was such an informative talk, doctor. Thank you so much.
Okay, welcome.
If you have any health issues, please write to us. Our email ID is youthdiaryroseball@gmail.com. See you next week. Till then, it's me Nita Ghosh signing off.